we're very much focused on outcomes and care pathways. People kind of surprised when I say that, because you can't say, well, isn't all health services focused on outcomes? But actually, when you think about it, it's not true. Virtually no healthcare services focus on outcomes around the world. So if you have a hip replacement, for example, it's treated as if that's your outcome, that you've got a new hip, but actually the hip is an input. What doesn't get measured in any formal way is whether you're able to walk freely and without pain afterwards.
Today, my guest is Chris May. Chris May is the founder of Mayden. Chris, welcome to my podcast. Thank you very much for joining me today. Please introduce yourself, introduce the company, and tell us what you guys do.
Thanks, Pete. Good to be here. So my name is Chris May. I'm the founder of Mayden and one of the directors. And we've just celebrated our 25th anniversary, literally this last weekend. So we formed in 2000, and the original aim of the company was to unlock all of the gold that's hidden in healthcare data. So prior to starting the company, I was working in management consultancy and doing lots of planning for the NHS, primarily in the UK, and realised that the NHS was just collecting loads of data and it just wasn't using it, and there was just so much valuable information. So the idea was to create a boutique analytics company with about 12 people. That was my dream, and it went terribly wrong, and we ended up employing today about 150 people, and we're based in Bath. So we've got a couple of offices here. And so we started. We've done quite a lot of work. We started off really as a project-based company, so an agency. Because we started in 2000, we had the dot-com crash, which some of your viewers might remember, some may not. And up until that point, the NHS hadn't really engaged with the internet at all. So while we were starting an analytics company, we really wanted to do what we did on the internet and build it. So we kind of got going doing lots of projects for people. But the big one that we landed was a massive national contract with NHS England to basically get rid of the postcode lottery in cancer care. And we did the digital work for that program. And we did it for, we had that contract for well over 10 years, actually. And by the end of that decade, there was no postcode lottery. So if you have cancer, you should get exactly the same quality of care wherever you are in the UK. But the thing that really helped the company scale up was when we actually moved from doing projects into product. And we got another contract to build a patient case management system for mental health services in 2006 for a new service, which is psychological therapies, and that the government was launching. Prior, all the way up until 2006, all you got on the NHS, if you had depression or anxiety or a number of common mental health disorders, was antidepressants from your GP. There was no other option, really. And so they decided to launch a psychological therapies program. We built a system to support that. Initially ran as a pilot. The pilot was successful, and then the program rolled out, and our software kind of rolled out with it. And when we completed that rollout, we ended up with about 70% market share. That's kind of, and because it was a product, we were, no longer charging for our time. We were charging for, for what we'd built.
Yeah, amazing. First of all, congratulations, 25 years. We've discussed it just before the podcast at the party at the weekend. Huge congratulations. Not many companies survive 25 years. So kudos to you. 2,012 people now, over 10 times more, huge contracts, fantastic software, and actually helping people, genuinely helping people. It's the business, from my understanding, it's essentially helping NHS to help more people, help them better. And huge congratulations on resolving the postcode lottery. So if I understand it also correctly, year 2000, you basically introduced internet to NHS, put it this way, right? So that's fantastic. And that made them actually collect a lot of data, because now if it's online, it's so much easier to collect the data. And now the company actually make sense out of that data. And really what you focus on right now is to really use this data to, bring better care, faster care to more people, and without the lottery. So fantastic. Absolutely. Now, you've mentioned NHS England as your clients. Who is your typical client? Could you name a few or tell
Yeah,
us?
sure. We've got about 220 customers
Mm-hmm.
at the moment using our software. 100 of those are NHS trusts, so that provide mental health services. So that's kind of like that takes care of almost half of it. A lot of our other customers are big charities. So we have in our product that we rolled out nationally was for adult mental health psychological therapies, but actually our product and we'll come on to this, but our product is also used in 80 children's mental health services. And one of our biggest customers there is Bernardo, it's a big children's charity. So they use our software in a number of places around the country. So, and there are lots of other mental health charities like Mind, people will be familiar with. So exactly. And then, of course, we've gone abroad with our software. So we have a number of organizations in Australia and Canada and Ireland who also use it.
Can you tell me a little bit more about what the software does, or maybe just focus on one product, maybe the most popular, just so we have better understanding what you do with that data? How do you turn what they already have or do, make it better, faster, or more accessible?
Sure. So it's a patient case management system. So there's lots of those around. And so if you go and see your GP, all your notes and appointments, everything will be, sitting on a terminal on your GP's desk, and they'll be constantly typing into it. Similarly, if you're in hospital, exactly the same thing happens. And if you're in a service that we look after, people will be entering that data into our system instead.
Mm-hmm.
Where we differ from other case management systems is that we're very much focused on outcomes and care pathways. Now, people kind of surprised when I say that because you can't say, well, isn't all health services focused on outcomes? But actually, when you think about it, it's not true. Virtually no healthcare services focus on outcomes around the world. So if you have a hip replacement, for example, it's treated as if that's your outcome, that you've got a new hip, but actually the hip is an input. What doesn't get measured in any formal way is whether you're able to walk freely and without pain afterwards. So, and that is really what you're looking for. But that kind of thing doesn't get measured in any meaningful way. So, our software was set about to change that, and we measure outcomes constantly. So we know that we're actually doing some good for our patients and that they're benefiting from the treatments they receive. We also use care pathways. So that's very similar to flowchart. So the patient effectively enters at one part of the flowchart and they flow through it, and they can go take different paths through the flowchart, but they kind of follow a journey through to the end. And then ultimately what we can do with the data is combine those two things together and say, okay, for a patient such as you, Pete, I would build a profile of you if I was your clinician, you came to see me, and I can then find all the other Pete's in the database that have gone before, looked at the journeys they went on through the care pathway, looked at the outcomes they got, and just using the data alone could start to look at recommended treatment options for you. So that's kind of where we're going, and we're trying to do that in all the spaces that we operate. As a piece of software, we were the first to be on the cloud. So, that's quite common now, but back in 2007, it was almost unheard of. And so we were different in that respect. And our software is particularly good at dealing with large volumes of patients. So we tend to go anywhere where there are huge waiting lists and a massive problem, because what we find is that compared to other patient case management systems, people can get patients through ours almost twice as quickly as they can on another system. So it takes half as long to register a patient, half as long to process their referral and that kind of stuff. So it's just, we just try and make it as slick as possible, because what we want is for the clinicians to spend time with the patient, not spend time putting data into the system. So.
Protecting the valuable time. The time that means more for the patient rather than spending that time there. And I did really liked how you gave the example of that hip replacement, because if they have a hip, yes, they've had a hip before, right? So that's not the outcome. It's the hip one, hip two. Are they able to walk and visit their family? That's what the patients really, really want, right? Not the hip. They've already had one. It's just not working properly. And if the next one, it's not this, it's not the outcome.
I'll get on my soapbox in a minute, so you must stop me. But when you think about it, we're all familiar with healthcare scandals. There's probably about 2 a year that hit the headlines, and we're all familiar with them. And when you look at what the problems are, a lot of it is because actually they've not been measuring outcomes. Because if they had, they would have spotted the problems much earlier, and a lot more patients would have not suffered. Whatever went wrong, and or if they were collecting the data, they weren't looking at it. And had they been, then again, more patients could have been spared whatever happened. I mean, sometimes if you get services where they have an excess number of deaths, and somewhere patients are just damaged unnecessarily. I mean, the biggest example of that is Harold Shipman, which I think most people would be familiar with. It's a GP who killed almost 200 of his patients, potentially the biggest serial killer in the UK that we've ever known in history. All of his patients died between 2 o'clock and 4 o'clock in the afternoon. We got to 200, almost 200 patients before it was actually picked up that something was amiss here, but it was always in the data.
Yeah. Yeah, I have to agree. If the data would be stored and analyzed, someone will be able to catch it, right?
And
That's a bigger volume. Yeah.
yeah, and the one outcome that is recorded consistently in healthcare is death.
Yeah.
So people die. Then that does get, but degrees of health don't generally get recorded.
Interesting. Fascinating. Yeah. So that data is there to obviously help doctors or help decision makers in those to improve very early on, really to find what is the quickest way maybe for the patient to feel better, but analyzing maybe different data from my understanding. It is fascinating. It is fascinating. And I would like to find out mostly who is the buyer, right? Because you've got software that's extremely difficult to sell. You can correct me if I'm wrong in this, but healthcare is very difficult to sell too, because there was a lot of people that would use this software. They're not essentially, they're champions. They're not decision makers. They're very difficult to connect. So who historically you've been talking to that is actually willing to change those processes, change how they operate, change that patient management system, and really start that conversation with you?
So it's usually the service lead, and that could be a manager, or it could be a lead clinician, or it could be both together. You don't usually sell a system without both the lead manager and the lead clinician being involved.
Mm-hmm.
So that's usually your way in. But of course, they're not always holding the budget. So they may want to buy you, but then they've got to go and get approval from, the wider sort of organization. But those tend to be the people. It's not usually the IT people. They don't buy our system. It's usually the clinicians and the managers. Yeah. And there aren't really any exceptions to that. But our software is generally, I mean, it is a difficult area to sell into. You're absolutely right, particularly with a new product. But once you're established, it does get a bit easier. And for the most part, over the last 15 years, our software is sold by word of mouth. So we've never had a sales team. And we generally do marketing, and we put on events, and because people come and then they get to know us through those events, and ultimately we hope that they buy our product.
Mm-hmm. Amazing. There are a few niches or problems that you want to tackle with your software, right? You said there are constantly new problems with big waiting lines. Before the podcast we lined up, for example, big topic ADHD, huge waiting lists. NHS doesn't really know how to process those and what to do now until there is a capacity for treatment or even diagnosis or anything. So how would you as a company approach this? Then there is a big problem. Do you go to those people? Do you historically wait for someone to approach you and say
No,
that they can help?
So this is where we had to change. So a minute ago, I said we had no sales team. That is
Mhm.
changing, because actually we've now moved into a place. I think once the healthcare market has changed, it's a very difficult place to operate at the moment. Probably it's the worst environment to do business than I've known for, pretty much the life of the company. And that's not just from Mayden's perspective. Everybody I talk to is saying the same thing. There is no extra money flying around. There's no real strategy. The government haven't got to grips with the NHS yet. The organisation which is supposed to lead nationally on strategy and investment and everything, which is NHS England, has just been scrapped by the Labour government, and it's currently unclear what's going to replace it and whether that's going to be any better. So yeah, it's a very difficult environment. What I said, however, still stands true. It's still the lead clinicians and lead managers who are going to make the purchasing decision as long as they're backed up with some money somewhere. And so what we need to do is find out who those people are and basically make them our best friends. That's essentially, what our approach is to doing that thing. So when we were selling into psychological therapies, adult ones, it was easy to do because we were well known and everybody knew about our product, even if they weren't using it. And when they decided they were ready to buy, they would come to us and they would have demos and everything, and and then make a decision. Similarly with children's mental health services, which we then moved into next, then we ended up, selling into those. And we've made friends with pretty much the entire industry in the UK. We put on webinars every month, and we have something like 600 people attend them. And there are only around 700 children's mental health services in the country. So, we've got everybody talking to us, and listen, but, getting sales from that is proving to be more tricky, not because people don't want to buy, but because the money's not there.
Yeah. But I love this approach because essentially what I would call education-based marketing. So just do the outreach one way or another through connections, through any other marketing activities or events, and educate the next step, what is possible, right? Doesn't mean there's going to be, the need is there, but the money is going to be there, the timing is right. But if there is timing, if you're going just to follow up regularly, maybe put another education piece, maybe compare it with a little bit different sector, right, and show similarities and what that transformation brought. When the time is right, these guys will go to you. They're not going to now sit down on Google, right?
The ironic thing is, although we're, sales are quite difficult at the moment, our sales pipeline is the biggest it's ever been.
Wow.
So we have a huge load of leads that we're kind of keeping warm and constantly talking to. It's bigger than it's ever been in terms of value, but very little at the moment is converting. But that's what everybody's saying. Everyone's waiting for their budgets to be agreed and everything. Yeah. So we just have to be patient.
And fingers crossed. But you're going to be a winning company there because obviously you've put the hard work upfront, educated them, created webinars, created that buzz, put them in your pipeline or even ecosystem. So now you can update and
yeah, and
maybe reach out at the point when you hear news. Okay, the budget is completed. We know the money. You can then outreach. When and completely person that they never had from before.
I'm quite philosophical about it because, you have fallow periods on a regular basis, usually prior to a general election. Everything quietens down and the services go into purdah. And so that sales are going to drop before the election. It usually picks up after an election, and it hasn't done this time. We've had a general election. It's a year since the government have been in power, and really things haven't got any better.
Said about education-based marketing, for example, you put that education piece, yeah.
Yeah, so our biggest area, you mentioned autism and ADHD, which is the biggest area that we're moving into at the moment. And because things are quite quiet, actually it gives us time to learn about it because we're not experts in neurodiversity. We've come from mental health where we're now we know a lot about it. We've gone from being followers to thought leaders in that space. In neurodiversity, though, we're still trying to understand exactly what these services need and what they want and what they need us from our software. So the fact that things are a bit quiet just gives us time to understand all of that and then to build the product. So when the market does open up, we'll actually have an even better product to sell into that space.
Amazing. Fantastic. I absolutely admire this approach and preparing for when the timing is right. Timing is right. There is a big queue. You can definitely help. Timing is right. But obviously the second part of the equation is the budget to support this.
And I think this is a ScaleUP podcast. And, I imagine almost all of your previous guests were said the same thing. But when I said we switched from projects to product back in 2007, that is essentially the same as saying we switched from one-off revenues to recurring revenues. And, the best way of scaling up a company is to unlock the power of recurring revenues. So whatever it is that you're doing, make it a recurring revenue if you possibly can, because that is the key to scaling up. And then it's kind of, what do you then provide and to who, etc. Those questions come to second in line. But the main thing is to, if you can find a way of delivering recurring revenues, then that's the most important thing.
And it's a fantastic approach. Obviously, from business perspective, is finding an offer that provides enough value every month, right, to the client that is actually making sense for everyone, and allows you to actually constantly develop this product, because at one-off sales, that's not the case, right? The product needs to evolve. That also requires investment, and that's when it kind of loses the value, and better product comes, and you, by securing that recurring revenue.
Yeah,
Essentially,
but when you have quiet periods, which is what we were talking about before,
yeah, perfect.
you don't lose revenue unless you lose customers. So as long as you keep the ones that you've got, you may not be growing, but you're not shrinking either, which is
Yeah. Okay, and then our previous conversation, we also discussed, because you've got a stellar plan, how you're going to grow the company, for another 25 years, if not even longer. Talk me through this: the deeper, wider, and further.
So, I mean, it's a phrase that we use: deeper, wider, further. I guess it's in some ways what a lot of people would be doing. And so, just to explain what we mean by it, deeper is effectively selling more stuff to your existing customers. So it's building new modules and making the software better for them, but adding value all the time and getting extra revenues from it. It may also be selling, new products to existing customers as well. Wider is about going into new areas, in our case, clinical areas. And so we went from adult mental health to children's mental health. And we're now we've gone into diabetes and cardiovascular disease and addictions, and we're now kind of in neurodiversity. So that's kind of going wider. And then further, which is the third pillar of our strategy, is going to different countries. So as I said earlier, we're in Australia, we're in Canada, we're in Ireland. So it's a kind of like a three-pronged approach. And, and I guess anybody who is scaling up will be thinking about all of those things. What we've done in the last year, well, actually, it was over a year ago, we did something called a core and adjacencies exercise, which you might be familiar with, which is really a way of prioritizing deeper, wider, further. So for each of those areas, like your product, you kind of say, right, with the product we've got, what's the nearest adjacent product that we could build that has the least amount of software development, but will, have added value to go into a new market. So going from adult to children's mental health for us was a relatively small step. We didn't have to do that much to the software to get into that space. And similarly, that's why we're neurodiversity now, because that's often been mixed in with mental health. It's actually now separating out as being a clinical discipline on its own, but it's an obvious place for us to go to. But core and adjacent is about prioritizing those and saying, right, of all the places we could go, which is the most sensible one to go to at this moment in time? Similarly with the product is, of all the things we could develop, what's the most sensible thing to, to develop next, to prioritize it? And then similarly going into different geographical jurisdictions, again, where is the most sensible place or the most adjacent places to go? So the reason we went to Australia was because they also decided to launch an adult psychological therapy service over there, which was based on the UK model. So it was a barn door open opportunity for our software to basically just slot right in, basically doing what it does in the UK on the other side of the world. So that's what we did. But, there were lots of places we could have gone. We chose to go there and, had some success. But yeah, I think deeper, wider, further is the kind of starting point of how we look at the landscape. But then the core and adjacencies is basically saying, right, okay, what is core? And then what's the nearest stepping stones from there to kind of go into those new spaces and prioritize them? And it's not just about what's the easiest thing to do. It's also about, is that market ready? So neurodiversity is not the easiest place for us to go to from where we are now, partly because it's a bit of a mess. And, there's a lot of uncertainty in that space because, as you mentioned, there are huge waiting lists for autism and ADHD assessments, and no one's really quite sure, how to tackle these. And so there's a lot of people in the NHS who are kind of ruminating on this problem at the moment. And they may come up with a model and a solution, and, and then we've got to get our software ready to basically fit in with that program when it arrives. But yes, the reason why we're focusing on that area and we're getting to know people in that space, all of the lead managers and clinicians, which I mentioned earlier, is because we think that's going to be the next big area, and that's where a lot of money is going to go. When we finally find out where money's going, and we've gone, we've moved away from other areas where the money just doesn't seem to be following. So, despite what successive governments say, is that they're going to put more money into prevention and less into treatment. It never happens. The hospitals generally suck up most of the budget, and there's never any money left to prevent people getting ill in the first place.
Yeah, and so is that cycle from the sound of it. It's the intentions is there, but the execution is actually the same, which essentially stops from preventing, which actually overloads the hospitals.
Just chasing it, so you're firefighting all the time, basically. And as a population, we're not very healthy. I think we're one of the sickest in Europe, which isn't
Really?
great because of our lifestyles, and yet we don't invest any money really on healthy lifestyles, which will ultimately save the NHS a lot. But it's chicken and egg. You just can't get to that point because you're spending all your money treating the people who are sick now.
Okay, and going back to your expansions and growth, if I'll leave the deeper out, because that's your relationships that we've had through years, and it's a little bit different than actually going after new services and new clients. Which one would you think it's gonna put more focus? Which one is easier, actually expanding in the UK to different services, or actually taking your product and adapting it to US market, Canadian markets for those services? And maybe you haven't mentioned any other countries in Europe. I don't know if it's because of the language, or why you decided not to go to Scandinavia, for example, or Germany. So which one do you think you would focus more if you could just choose one of those two? And
I know the answer to that because we did the core adjacency exercise and we came to the conclusion that wider was definitely for us. Now, and that's not to say that's true of everybody. For some people, going to the US would be the obvious thing to do. And certainly people in our space, or some of our peers, have placed big bets on America. Some have crashed and burnt and lost lots of money, and others have been successful. It's a big gamble, but we looked at all of it and decided, we wanted to go wider, and there were still lots of the NHS that we thought needed our help. I mentioned a minute ago, most of the money goes to hospitals, which is absolutely true, but it's at the expense of community and mental health services, and it's those services where our software slots in really nicely, and it's quite it's cost effective. So we think there's a lot we can do in community and mental health services yet. So that's where we're focused, but we are still looking at opportunities abroad. And and we're also looking at, one of the things that I think we've learned is you don't really get anywhere in the US if you're a UK company. You have to have a US entity, and you can either create that yourself from scratch, which is quite hard work, or you buy something over there and then make it part of yours, and then you have a ready-made team and a ready-made, hopefully, distribution channel. But moving to the US is not, for somebody in our space, software and health tech software is not easy. All of the security standards and all of it is completely different to the UK. Much tougher, and you have to go through the whole thing again. So everything that we've built to be able to operate safely and with credibility in the UK and Europe mainly doesn't apply over the US. You're kind of starting again. So, but that will be different for different industries and sectors.
Absolutely, and I completely agree. There's obviously there'll be a lot of roadblocks going to different countries, and it actually makes sense. Even if in the UK someone will be digitizing this, and the company is from Germany, there'll be questions raised. Why have we not got enough companies here, right? So even how governments operate and how they want to keep it within the
language
country.
is a thing. Yeah, language is definitely, we our software is not yet ready to be delivered in multiple languages. So we've gone to English-speaking languages.
Yeah.
Australia is where we're biggest abroad, but actually their systems are very UK based. So their data protection regimes, and all the kind of stuff is very similar to English systems. So we haven't had to do much adaptation to be able to slot into Australia.
Yeah.
Similarly, Canada, there's more in Canada, but the US will be more again.
And I absolutely love the fact that you're looking in a country here, what are the big problems where you can help, trying to educate yourself on how you can help, really having better understanding while actually networking and finding those people that could be responsible while once the money is available to make those decisions, make some changes and speed things up. So absolutely love this approach. Absolutely amazing. If someone from our listeners would like to find out a little bit more, we are well connected with the work, digitalization and especially actually healthcare. On a few conversations, we got quite a few followers. If they would like to find out a little bit more about you and the company and contact you, where could they find you?
Well, that's pretty straightforward. We have a website like everyone does. It's mayden.co.uk, and that's Mayden.co.uk. And I'm on LinkedIn. If you search for Chris May, Mayden, then I should hopefully come up at the top of the list.
We'll leave those links below so anyone interested can go reach out to you, Chris, and start this conversation or have a look on the website and find out a little bit more. Listen, thank you very much for this. It's been a fascinating actually conversation, how you approach the business and the growth. Yet again, congratulations on 25 years of growth. And I wish you all the good luck with that expansion, because it's actually going to resolve a lot of problems in the UK with queues, and you actually have got products that are ready to tackle them. You've got fantastic way of attracting those prospects, champions and decision makers and people that would be responsible to make those decisions one day when the money is here. And I wish that money is available and those conversations and that, as you said, the biggest pipeline you've had for a while starts converting, because it's not just the business, you're also doing something that is going to be so useful, and so actually helping people and reducing those queues without actually employing thousands of staff to reduce those queues. So thank you very much for this. I really appreciated this conversation. Thanks a lot.
Thanks, Pete.